Diphtheria is a life-threatening communicable bacterial disease that causes critical inflammation, swelling, and tenderness of the throat and nose. Diphtheria is caused by a bacteria known as Corynebacterium diphtheria. These bacteria produce toxins which cause abnormal membranes to grow in the throat and nose. This disease is extremely rare in most developed countries, including Australia, because of the diphtheria vaccine. As stated before, the diphtheria disease is caused by a bacteria known as Corynebacterium diphtheria. These bacteria prevent the production of protein by cells. It also destroys the tissue at the site of infection. The disease has then transferred into the bloodstream and has been circulated to and around the body's tissues. Diphtheria is an infection that is only spread amongst humans. These bacteria are usually spread through person-to-person contact, such as droplets, which have been breathed out into the air, secretions from the throat and nose, infected skin lacerations, grazes and tears, and objects such as bedding or clothing, although this is a rare occasion. Since diphtheria affects the throat, nose and tonsils, the early symptoms consist of a sore throat, a loss in appetite, and a small fever. In the next 2 to 3 days, a blue, white, or grey coloured membrane will form in the throat, usually around or close to the tonsils or in the nose. Due to the membrane attaching itself to the throat, bleeding may occur. This then turns the membrane a grey, green, black colour. The membrane can cause breathing problems and can cause problems when swallowing food. The person who has contracted this disease will either recover after this stage, or they could develop a severe weakness to this disease and die within the next 6 to 10 days. Severe cases of diphtheria cause patients to develop swollen necks and obstructed airways. Diphtheria can also affect the skin. This is known as cutaneous diphtheria. Cutaneous diphtheria results in pus-filled spots on the legs, feet, and hands. These spots can then form into large ulcers surrounded by red patches of sore, discoloured skin. This ulcer generally heals during the space of 2 to 3 months, but is most likely to leave a scar. This disease is preventable through the immunization of the Diphtheria vaccine. This triple antigen protects us against 3 diseases: diphtheria, tetanus, and whooping cough. This vaccine is recommended as part of routine childhood immunization. It is free under the NIPS, National Immunization Program schedule. Children should be given 5 doses of the diphtheria, tetanus, whooping cough vaccine at the ages of 2, 4, 6, 15 to 18 months, and 4 to 6 years old. Adolescents and adults are given a tetanus diphtheria vaccine as additional shots every 10 years. Adolescents are given the shot from ages 11 to 18 years, but preferably at the ages of 11 and 12. Adults 19 years or older are given a single dose of the vaccine. Pregnant women should receive a dose of the vaccine during each pregnancy they go through. The dose should be given at 27 to 36 weeks to increase the protective antibodies that will be passed on to the baby. When the bacteria enters the body, there is an immediate immune response. Multiple cells in the immune system will work together to prevent the pathogen from lingering and colonizing in any area of the body. Once the DTPA vaccination has been distributed into the body, it will learn to fight off this disease. It is advised by the NIPS that all children should be vaccinated against this disease, although there are a few implications where it is not wise to be vaccinated for the disease. If you have experienced a life-threatening allergic reaction to a previous dose of any diphtheria, tetanus, or whooping cough vaccine, or you have a serious allergy to any part of the vaccine, if you have had a coma or repeated seizures within 7 days after receiving a child dosage of the vaccination, you must talk to your doctor if you have experienced seizures or other nervous system problems, aren't feeling well on the day the shot has been scheduled, have severe pain or swelling after any vaccination which contains diphtheria, tetanus, or whooping cough. Vaccinations reduce the risk of infection by working and supporting the body's natural defense, which is the immune system. The process of vaccinations impersonate what would happen naturally if a harmful bacteria or virus entered the body's defense. It does this to help develop a safe immunity to the certain diseases in which it is fighting. The immune system produces T lymphocytes and antibodies to fight the disease. Vaccines develop an immunity to an infection. This means that the infection does not cause the illness, but it causes the immune system to develop an identical response to a real infection. This means that the body will be able to distinguish the infection and fight it. In Australia, it is not compulsory for a child to be vaccinated, although the government advises and encourages that parents should take the action to vaccinate their child against diseases. In 2016, the New South Wales Health Works partnered with schools to offer vaccines that are recommended for adolescents in high school by the National Health and Medical Research Council. High school students who had given consent to participate in the vaccination program were vaccinated against varicella, diphtheria, tetanus, whooping cough, and human papillomavirus. Students who were in Year 7 and had given consent received all of the vaccinations listed above for free. Through students receiving these vaccinations, they are unable to contract the diseases, meaning that the HPV, diphtheria, tetanus, whooping cough, and chickenpox viruses are all under control. If there was a breakout of one of those viruses, it is a good chance that most of the New South Wales population would be unaffected due to their immune systems knowing how to fight off those diseases. From December 2015 to September 2016, there has been 94.11% of children aged 12 to 15 months being vaccinated for diphtheria, tetanus, and whooping cough in New South Wales. For children aged 60 to 63 months, there were 94.03% being vaccinated in New South Wales for diphtheria, tetanus, and whooping cough. There were 93.09% of children aged 60 to 63 months fully immunised in Australia. Due to this current data, it is quite evident that the immunisation program the government is currently using is working effectively. The current rates of diseases such as polio, diphtheria, and smallpox are decreasing, and the rates of immunisation against those diseases are increasing. People are being immunised today as it is still the safest and most effective way of protecting people against vaccine-preventable diseases. When a person is immunised, they are less likely to catch the disease. Since the diphtheria vaccine was introduced to infants during the 1940s in Australia, the cases of diphtheria have been slowly decreasing. In the 21st century, there are no cases of diphtheria, and the introduction of the booster dose of DTPA at 18 months has ensured that the spread of the disease does not continue. Since the introduction of the IPV in July 1956, the cases of polio have been decreasing in Australia. The introduction of the combined DTPA, Hep B, IPV, BIP vaccine in February 2009 has allowed for the polio disease to stay under control. Smallpox was eradicated in 1979. The vaccination was introduced in the 1850s. Routine vaccinations were introduced during the 1970s. Due to these routine vaccinations during the 70s, there is now no need to continue to vaccinate the Australian public, as it is very rare to see smallpox in Australia again.